Good morning, everyone. We're just going to wait for a minute for more people to join in and then we will start. All right. Thank you so much for joining us today for the fifth episode of A Surgeon's Perspective, a series where we sit down for a conversation with a surgeon and ask them about few of the most common questions, misconceptions, and doubts people have about their respective field of expertise. In today's episode, we are going to discuss about knee ligament injuries and their causes as well as management. Knee ligament injuries have become so common that most of us know someone who has suffered from a ligament tear and has either undergone or has been advised to surgery. And that's why we decided to dedicate this episode to knee ligament injuries and understand more about the reasons why knee ligament injuries are so common and what are the ways to fix them. And who would be better than surgeon we have today, the creme de la creme in the field of knee surgeries. He really needs no introduction. He has put the city of Pune on the world map, shining bright in the field of orthopedic rehabilitation with his tireless efforts and great dedication towards one goal of serving his patients to best of his abilities over the last 3 decades. An internationally acclaimed orthopedic surgeon, specialist of the knee arthroscopy and replacement surgeries, chairman and managing director of Sancheti Institute of Orthopedic Rehabilitation, Dr. Parag Sancheti. Apart from doing his MCH, MS, and DNB in orthopedics, fellowships in various hospitals from UK, Switzerland, Germany, and US, he has been awarded prestigious honorable FRCs from Royal College of Surgeons, Edinburgh, honorable doctorate degree, Doctor of Laws from University of Dundee, UK. Because of his immense interest in clinical research, he has published over 80 research papers in various national and international orthopedic publications. He has co-authored various books and numerous chapters in orthopedic textbooks. He has received Best Presentation Skills Awards of distinction during his MCH course at Dundee University in UK in 2003. Dr. Parag has Dr. Parag serves as a visiting faculty at the University of Dundee, UK, and MC Master University at Hamilton, Canada. He has chaired many prominent orthopedic societies and associations in Asia Pacific region. So without further ado, let me welcome Dr. Parag Sancheti to the fifth episode of A Surgeon's Perspective. Thank you so much for joining us today, sir.
Good morning. Good morning.
And
How are you? Thanks for the kind introduction.
thank you. And let me first apologize to your family for stealing you away on a beautiful
Oh,
Sunday.
no, not at all. It's my honor and
Uh,
my.
so before we go further, we are really honored to have you today. Today is a special day, and you hold a special place for all of us at Healyos. You've been a mentor and the strongest supporter of Healyos from its inception. Today is Guru Purnima, and on that occasion, from on behalf of everyone at Healyos, I would personally like to extend our gratitude for always being there for us. Thank you so much.
Thank you. Thank you so much.
All right. So, coming to today's topic of ligament injuries, before getting into that discussion, I would like you to share a few words about what is this whole COVID-19 situation has done to a hospital, like running a hospital and surgeries, elective surgeries that happen there regularly. Is there been any impact on that?
Oh yeah. Oh yeah. So all of us know that in the last 3 months we are going through a very unprecedented pandemic, something which was never expected. And every day is a new day. Every day the dynamics are changing. Every day the new norms are changing, and we still don't know when we are going to see the light of the day.
True.
Since 3 months, the elective surgeries at Sancheti Hospital have gone down. We are just doing 20% of the work. More of the work which we do is trauma related and related to casualty, emergency work, dislocations, fractures, that kind of a work. And understandably, people are bearing up the pain and not coming forward for knee surgeries, knee arthroscopies, knee ligament injuries, and various surgeries which are elective surgeries. When we say elective surgeries, these are planned surgeries and they can be planned as per the convenience of the patient. So they are not emergency and can wait. So such surgeries, patients are waiting, bearing the pain. And also, if
Right.
you see the injuries itself have reduced in terms of sports injuries and injuries because of playing and accidents because the sheer number of vehicles on the road and people going out and playing have gone down.
True, true, very true. Okay, so coming to the first question, do you see that there has been any increase in number of ligament injuries in of recent years? Like earlier, I remember the injuries used to be like ACL being a most common ligament injury in the knee. Used to be morely to people who play football or sportsmen or field on-field athletes. But now that I have seen that injuries are very common in non-athletes. So is there a reason why that has happened?
Yeah, definitely. So leave these 3 months, but before that, the kind of pattern which we see in India for knee injuries, especially ligament and meniscus injuries, is completely different than that what is seen in the Western population. In Western
Right,
population, it is more because of sports injuries. Most of the knee ligament injuries are related to sports like
right,
skiing,
right,
basketball, football. But in India, of course, sports are there. Sports like kabaddi, kho cricket, they do cause, but also 30 to 40% of injuries are because of just falls while walking or getting onto the bus or two-wheeler accidents or twisting while going down the steps and things like that. So it's a little different pattern than what is seen. It's not necessarily related to sports. That's the
right.
difference in India.
Right, very true. So my next question is: are there any signs of knowing that a person is at a higher risk for ligament injuries, so that they can be more careful about it?
Yes, so if you see the knee ligament injuries, by and large, are more common in female patients, and that is because of the estrogen and the hormonal flow there,
Right,
the ligaments are more lax and they're more prone for injuries. Also, what
hmm.
happens is because of the valgus nature of the knees. When I say valgus, it means the knees are going more outwards
Right,
in females, and also the elbows. If you see, they have more of the carrying angle. What we say, the angle of the elbow is a little more. So these kind
right,
of physiological variations make the female patient more prone. At the same time, people who have lax ligaments or people who have weak bones, people who have weak muscles, there are some people who are just prone for falling. We have some
right,
patients who visit the casualty like every 6 months there something will happen to them. So these are the kind of patients, or these are the kind of population, I would say, the soft sportsmen or even the recreational athlete who are more prone to injuries out there.
right, right. Okay, thank you so much for answering that. Uh, when we come to sports and in sports injuries, which is your area of expertise, why knee ligament injuries are more common compared to other sports injuries?
So if you see, there are two joints in the body which generally get affected more. One is the shoulder and one is the knee. So if you see the
Right,
upper limb injuries, the more common are the shoulder because that is a joint which has to be used for all overhead sports, racket sports like badminton, tennis, athletics like javelin throwing, shot put,
right.
and these have all the brunt on the shoulder. Similarly,
Hmm.
in the lower limb, when we are running, when we are playing sports, any kind of high impact or what we call as contact sports like football, rugby, basketball, these are the sports which have a lot of force on the knee. And knee is a joint which has mainly two movements, the flexion and extension. And
Right,
when the foot is fixed, the femur bone rotates on the tibia. The knee joint is made of the femur, which is the top bone, and
right,
the tibia is the lower bone. So the tibia gets fixed with the foot, and the femur rotates. So these are the rotational injuries, and the whole brunt instead of the hip and the ankle is borne by the knee, and therefore knee injuries are the most common as compared to the hip or the ankle. And for that matter, if you compare the statistics of shoulder injuries to knee injuries, again knee injuries is most common, and uh, it is all related to the biomechanics where the forces act on the knee. And even if you see, if somebody is playing football and he trips, or if somebody is tackling in football, the injury is always to the knee. Very rarely you will see a foot the getting injured,
right,
or
right,
also the hip, because the hip has multi-axial movement. It
right,
rotates all around. The ankle and the foot joints are very supple, but the knee is something very different, and because of its inherent structure of the ligaments and the meniscus, gets more prone for injuries.
Right, right. Thank you for answering that in such detail. Now there has been a lot of confusion in people's mind, a lot of doubts. In case of a ligament injury, when a surgery is recommended and when it is managed conservatively or non-surgically. So let me ask you, what factors are taken into consideration to decide surgical or non-surgical approach for the ligament injury management?
Yeah, yeah. Excellent question, Saurabh, because that's always the dilemma when patients
True,
come
true.
in. The patients always hope that the surgery can be avoided because nobody wants to undergo surgery. You know, if given a choice, everybody will say that, okay, please make me fine without operation, make me normal. Here is the question when you have to answer that if I treat this ligament injury without surgery, will the patient get back to normal? Or
Right,
to get normal, does he require a surgery? And the whole crux of the answer is in that. And if the ligament injury is partial, if the meniscus tear is incomplete and in the area where it can heal, then these are the patients which actually can be treated non-operatively with rest, with immobilization, and over a period of time, the injuries do heal. But it is important to identify which injuries are going to heal. For example, if you have a complete tear of the anterior cruciate ligament, which is a very commonly injured ligament, and that is the ligament which connects the thigh bone, the femur, to the leg bone, the tibia, and gives stability to the knee joint. And if that is completely torn, then it has been shown that the patients will never get back to normal because it will have an impact on the day-to-day activities. Also, it will have impact on patient carrying out strenuous activities, doing sports, doing trekking, even climbing steps up and down, running and
right,
catching a bus or a train, and they will feel unstable. So if that is the situation, then these are the kind of patients which will require a surgery and will require some intervention surgically to get back to normal. So many patients say that, okay, I will rest for 3 months, 6 months, but the ACL, the anterior cruciate ligament, once it's completely torn, never heals. So we have to take it case by case. And our
right,
endeavor is always also if the patient can be treated non-operatively or what we say conservatively in our language, then that is
very
our
true.
endeavor and the main treatment will be accordingly. And the physiotherapy at that time plays a very important role in the non-operative or the conservative treatment and also equally well in the operative treatment. And we'll talk about that a little later. But to answer your question, if we know that the outcome of that injury by rest, by treatment with tablets, physiotherapy is going to be normal and the patient can get back to his active life and sports, we will treat it non-operatively. And if that's not the case, where the patient will have some kind of limp, some kind of giving way sensation, instability, pain, is not able to go do his routine active activities, then these are the patients on whom we will operate. So that's in short how we decide whether to operate or not operate, and an MRI and X-ray and a clinical evaluation helps us to do that.
Right. So that really clarifies the whole decision-making process behind that, and I guess that will clear a lot of doubts people have in their mind. Now,
Yeah.
coming to the next question. So, even though a ligament injury, there's a complete ligament tear and a surgery is recommended, still because this is an elective surgery and there are a lot of factors out there because of which sometimes people delay it. Me being a victim of the same, I had a bilateral ACL ligament injury back in
Oh,
2013 and I delayed it for about 4 to 5 years. And I have seen the negative impacts of it and what really happens because of that and how you live with it. So I just wanted you to clarify this to our viewers. What are the negative impacts of, or are there any negative impacts of delaying a knee ligament reconstruction surgery after a complete rupture of ligament?
yeah. So just before I answer that, there are two types of ligaments in the knee joint. One is
Right,
inside the knee and one is outside the knee. So inside the knee, again, we have two ligaments, the ACL, the anterior cruciate ligament, which you just mentioned, and the
right,
PCL, which is the posterior cruciate ligament. So these are the two ligaments which give stability within the knee joint. Now,
right,
outside the knee joint, also there are ligaments called as collaterals, the medial collateral and the lateral collateral ligament. So there is again a chance that you have a complete tear of the medial ligament, the lateral ligament, or the ACL or the PCL. So if it is a ACL complete tear and associated with the MCL tear, then these are the patients whom we have to operate because delaying them or not subjecting them to surgery can make the knee weak, can cause arthritis in the long run. Because what happens is that the stabilizing factors are not there. the cartilage is under friction. It keeps rubbing against each other because of the lack of support of these ligaments, and then the arthritis sets in early. That is number one disadvantage of delaying the surgery if it is required. The second is the patient never feels confident of walking, running, or doing any kind of day-to-day activities. They will be inhibiting themselves and depriving themselves of an active lifestyle if the surgery is delayed, and they kind of get adapted to it, and they develop a limp, and the muscles of the knee joint, around the knee joint, the quadriceps, hamstrings, they get wasted, and because of that the limb becomes thinner as compared to the opposite side, and they develop so-called a permanent limb. So there are many disadvantages of delaying a surgery when it's required. If it is not required, you give a plaster, you give a brace, it heals. But a complete ACL tear, a complete PCL tear, definitely requires surgical intervention, more so in the young. In the elderly patients, these injuries are seen if it is the patient is above 55, 60, and if they are willing to give up an active lifestyle like doing sports or some trekking, mountaineering, skiing, then they can be managed and they can be balanced. But I have seen patients, the eldest patient I have done ACL ligament surgery was 68. He was an active
Wow.
68. He used to play badminton. And he said, Doctor, I want to play badminton again. And at 68 also, I did a ligament surgery for him. And he's still playing active badminton. So
It's
that's
amazing.
the problem. If you don't do the surgery, then the arthritis will set in instability and they will have permanent issues. So if it is required, we should never delay it.
Right, right. So in a nutshell, for our viewers, if you want to continue with the active lifestyle that you currently live, and just in case you get a ligament injury, it's always a better option to get operated and get reconstruction done, so you can continue with your active lifestyle.
Yes, yes.
So you in the passing you mentioned the role of physiotherapy in ligament injuries. So that's what my next question is about. So what is the importance of physiotherapy before and after the ligament surgery, and how long should it be followed?
So I think the most critical part for knee ligament injury, for that matter, any orthopedic surgery, is rehabilitation. Now,
Right,
knee exercises, knee physiotherapy, knee rehabilitation is a little different than the other joints, because in this we have something called as rehabilitation. So
right,
before a patient is subjected to a knee ligament surgery, or if patient has arthritis or is subjected to, let's say, a total knee replacement, then
right,
these are patients who require a prehab. By prehab, we mean that if the ACL tear is there, the patient has a loss of movement. His knee is not bent fully. So we give him a set of exercises and make the knee bend fully, make it supple, and then we subject the patient to surgery. So that is the importance of rehabilitation, or what we
right.
call as the prehabilitation. The
Rehabilitation.
surgery is done, then the post-operative period is very critical. I would say that at a score of 100, I would give only 50 marks to the surgery and 50 marks are given to the post-op physiotherapy. Because if
Right,
physiotherapy is not done well, your ligament is at a risk, because the knee can become stiff, the muscles can get wasted. And I've seen patients at 4 weeks, 6 weeks, 2 months, sometimes they just don't do physiotherapy in spite of telling them, and the muscles are completely wasted, and then they don't activate, and then they don't get stimulated, and that becomes a big issue. So it is very important to have good rehabilitation, good exercises after the ACL, and there is various types of exercises which we have been advising our patients: accelerated rehab program, closed
right,
kinetic exercises, open kinetic exercises, and all kinds of things which you people know better at Helios.
right, right. Wait, thank you so much for answering that. Now, my next question is post-operative ligament laxity. So I have seen personally while treating a few patients who continued with physiotherapy for a month, month and a half, and the day they could get back to their regular routine, they stopped doing the exercises because to them rehabilitation means getting back to normalcy rather than strengthening the whole thing and following up the complete 6 months rehabilitation program. In such patients, I have observed after a year and a half, they start developing the symptom of ligament laxity. So why? What exactly is post-operative ligament laxity? And why does that happen?
So this is a question, very interesting question. I would like to answer it in two ways. One is some people, as we have discussed in the initial part of this program, have a more tendency to ligament injuries, what we call as the laxity. The joints are more lax, and these are the people who stretch out the reconstructed ligament also. So over a period of time, what happens when they get more active, when they get back to sports, when they get back to their routine active lifestyle, the ligament gets stretched out, and after 1 year 2 years, then they again develop some kind of instability, and these are the kind of patients who have to be actually warned. And there are ways to find out how a patient has inherent more laxity, or is more prone to the post-op laxity. And these are the patients who actually, you must have seen that some people actively dislocate their shoulder and they can
True.
put it back. They actively kind of bend their thumb completely, and that touches the forearm also. See, my thumb
Yes.
cannot touch my forearm,
Yeah.
but this is the way
Very
to find out. Or they hyperextend their knees. If you see
right.
the knees goes to about 0 degrees of extension, or at the most 5 degrees in you and me. But these are
Right.
people in the knee hyperextends to 15, 20 degrees. When I say hyperextend, this is extension and it becomes full like this, goes behind. And
Right.
these are the things then you have to know before surgery that they are at a higher risk of stretching out that ligament. You got to tell them to be a little slow. And there are ways during the surgery where we can actually strengthen their ligament by some means, by using some kind of suture material and augmenting the ACL reconstruction. The
Right.
other
Okay.
set of patients who will have ligament laxity post-op is if they have an injury again, or if they fall down again, or if they are, not following the rehab, they are going back to sports earlier than 6 months. Then these are the patients because the ligamentization is not complete, and they are
Right.
kind of using the knee before the ligament has completely incorporated and become its normal shape, size, and texture, and has regained the biomechanical properties of the original ACL, and that takes 6 months. So if they
Right.
do anything before 6 months, then they can stretch the ligament and also damage the operation. So these are various reasons to answer your question of post-operative ligament laxity.
All right. I guess you have very concisely put all the reasons why it happens, and it's very important to follow the 6 months of complete rehabilitation protocol before you go into any high impact activities.
Yeah,
My
yeah.
next question. So, since I was a kid, I've been seeing sportsmen getting injured, and all the surgeries they are either going to UK or the US, going abroad and getting the surgeries done. But now that's not happening as much. Here in India, we are doing surgeries. You have treated a few sportsmen yourself. Come to that in a bit. So, what I want to know is, have there been any technological advancements in ligament surgeries, and is that the reason why the recovery or early return to normalcy is possible?
Absolutely, absolutely. Ligament surgeries of the knee is definitely undergoing a evolution. There are more now technologies and more enhancements of this operation to give a better result. See, the first question what the patient asks me is, when will I get back to normal life? When will I get back to sports? What we say RTS, return to sports. So that
Right,
is something important. Now we have ways to, kind of enhance the surgery, enhance the healing and the ligamentization by adding certain stem cells, PRPs, or other kind of mesenchymal cells to the ligament, and ensuring the healing faster. The second is the technology. What kind of equipment, instrument, because this is one surgery which is very equipment dependent. Now this
right,
surgery is done just by one keyhole. It's just one small keyhole, and through that we put the telescope inside. We put a camera, and what is inside the knee is seen on the television, and we operate actually looking at the television and not at the knee while doing the surgery. So
right,
the surgery is dependent on what you see. If you don't see well, you cannot operate well, because it's just a keyhole. You're not opening the whole knee joint like a knee replacement. When we do a knee replacement, the difference is we directly see the structure with our own eyes into the knee joint. Here the difference is we see the inside of the knee joint on the television monitor which is in front of us, and we are using the instruments on the knee and looking somewhere and operating. So if you
right,
see better, then you operate better. So now we have three chip cameras, we have good handheld instruments, very precise instruments, some jigs where you can get the exact angle. So all these things have come in and have improved the outcomes of the surgery. So two things: enhance the healing by materials which are injected inside, and use better equipment and technology so that you see better and you operate better and with precision. So these are the enhancements. And at Sancheti Hospital, I'm happy to tell you that we have all the latest equipment required to carry out this keyhole surgery, and we have given very good outcomes to our patients.
And very true. Because of the kind of surgeries that are done in Sancheti Hospital, we as physios get a free hand to be a bit more aggressive with our physiotherapy and get people back to their sports as soon as possible.
Don't be too aggressive, but
No,
just go slow.
for sure, for sure. All right. Can elite athletes return to their competitive sports at the same level of performance post the surgery?
Yeah, so that's an excellent question, because what happens is whenever a sportsman is in his competitive time, in his, they have seasons, like they have competitions, they have tournaments, and if an injury happens that time, they feel very frustrated and they want to get back to the level of sports they were playing. So it
Right.
again depends on the type of injury. If the patient does have a complete ACL tear, then that patient has to miss that season, because he's not going to get back to sports in 1 month or 15 days. Or if a
Right.
cricketer while bowling has a ligament injury, if a tennis player has an injury, if we have people who play hockey and shooting sports, and then they require some time. So it again depends on the time of injury. And but what I can tell you is that the sportsmen, because of the inherent quality of doing great physiotherapy, because of their muscle built up, can get back to sports early. And as far as your question is concerned, can their performance be the same? Yes, they can be. And there are examples where people have, after injuries, gone back and won gold medals and medals at Olympics and various national and international competitions. So they can get back to that level of sports, but they have to be a little careful, because that is a reconstructed ligament. And once that particular time elapses and the strength develops, they are able to perform exactly what they were performing before the injury.
Right. So you've mentioned about winning gold medals, and you've mentioned hockey, and you've mentioned shooting, and I know the stories of you treating Gagan Narang and Sandeep Singh. So would you like to share your experience with them and how their recovery to that gold medal was?
Yeah, so I've treated many elite athletes, and Sandeep Singh, our ace flicker. There was a movie also made for him, and he's been an excellent patient. He had a back injury, and he was treated at Sancheti Hospital, and this was happened when he was training at the Balewadi Stadium. And then we treated him. We had some special injections for him. He got back to his active lifestyle, and then he went back and played for the national team and won various tournaments after that.
Very
So
true.
I cannot divulge more details, but this is what is important. If the patient has the will, and Sandeep Singh is an example. You must have seen his movie also, because he wants to come back, and he said,
Very
"Doctor,
true.
do anything. I'm willing to undergo the treatment, but I want to play competitive hockey again." And he showed us that he played. He won against Pakistan and New Zealand
Yeah.
immediately after getting better, and that's how he was treated. Also, one more example is of our shooting legend, Mr. Gagan Narang. He also has been working out of the Balewadi Stadium. He has now started himself a very big academy which is called as Gun for Glory, and he's
Right.
teaching people. But at that time, when he had a problem, he has a problem of the heel. We treated that problem with again rehab, physiotherapy, injections. He went and he won us a silver medal at the
Very true.
Olympics shooting. So these are the kind of patients we have, and they really perform well and get back to the active level. So sports injuries can be treated well. There are many such elite athletes, cricketers, badminton players we have treated at Sancheti Hospital, and I'm happy to say that most of them have been able to get back to the normal level of their activities and sports, and they really are very happy with the outcome of the knee ligament injuries and meniscus tears they have had.
Right. I guess that story has a very beautiful message to all the young athletes that are out there. Just a ligament injury doesn't mean you need to end your career or you need to take a back foot. With a good surgery and a good rehabilitation, you can get back to your form and continue pursuing your dream for sure. My next question. So before we are almost at the end of the conversation, and I would like to tell our viewers, in case if you have any questions that you would like to ask Dr. Parag, please start putting them in our comments. He will answer all the relevant questions. Well, next question, we have talked about the causes and the surgical management of it, and I want you to talk a bit about prevention. So, what should be done to reduce the risk of ligament injuries?
Yeah, that's an excellent question. We always say prevention is better than cure.
Very
And
true.
how do we protect the knee ligament injuries? And as I said, these mainly happen in sports, and in India they also happen, because of some two-wheeler accidents, twisting while going up and down, or catching a bus or something. So how do you prevent it? One is to make the muscles strong, which is by doing exercises regularly, strengthening the muscles around the knee joint, the gastrocnemius, the hamstrings, the quadriceps, and keeping them in shape. The second is, while you're doing sports injuries, you should wear a proper gear. You should wear a proper knee braces, the proper protection
Right.
which you have to use for the knee joint. So you must have seen whenever these tennis players, football players, basketball players, they always have knee braces and they have
Very
some
true.
kind of caps. It's not necessary that they would have had a previous injury to the knee if they are wearing that, but since this sport is highly prone to injuries, then the knee braces do help. So protective gear is important. Proper shoes are important, because if you don't have proper shoes, then the loading of your knee is changed. It loads either on the medial or lateral side if the shoe is not really proper, and
Right.
then the problem is that you get these knee injuries. Additionally, the playing situation, the playing ground, the circumstances, the type of the ground you're playing on, the turf, the surface of the ground does matter. If there are sometimes, recreational sports, they play football on uneven grounds, and these kind of grounds or surfaces again make the sportsman or the
Very
athlete
true.
more prone for injuries. So we have to just assess it and be careful that you don't do all these things which can make you more prone for injuries. So wear a proper knee brace, wear the protective gear, wear proper shoes, do a very good warm up. That is again very important, because I have seen that people sometimes just get into the sport immediately without warming up, and warming up and cooling down is again very important, before a event and after event. So warming up you have to do, choose proper playing surfaces, and then one can definitely reduce these knee ligament injuries. So that's very important, and prevention is better than cure. So always try and avoid these injuries. They are best avoided. Once it happens, we'll treat them, but if you avoid them, that is even better.
Very true. Very true. Thank you for answering that so concisely. We've already have some questions for you, sir. So
Sure,
I'm just
sure,
going to
we'll
take
go.
a glance through it and I'm going to tell you a few. All right. So we have a question from Atul.
Yeah,
So,
yeah, yeah, yeah. Please ask
hello.
the question.
Yeah. Oh, sorry. So good morning. Any suggestions for people who gone through knee surgery and staying in home due to lockdown?
Yeah, that's an excellent question. And a lot of my patients who have been getting operated, Atul, have been asking me this question. Some have been undergoing physiotherapy rehab, and the surgery has just happened before the lockdown, or some have got operated during the lockdown. I think at home, most important thing to do is to do your rehabilitation and physiotherapy well, because if you don't do it, again you'll have muscle wasting and the ligamentization won't occur. I know you may not have the best of access to equipment and gymnasiums and physiotherapy departments like we have in the hospital, but there are many ways and exercises what you can do to tone your muscles. You can do half squats, you can do various kind of exercises even sitting at home, and strengthening the muscle. What kind of exercises can be done can be told to you by the Healyos physios, but now they have started something called as online physiotherapy. So there is a possibility that even though you don't have much equipment and much gadgets to do your physiotherapy at home, but yet something is better than nothing, and otherwise your surgery will get spoiled. So definitely we can help you by giving you a home rehab program and strengthening your muscles. So definitely, you cannot just say that it's lockdown, I won't do the physio. There is no equipment, no gym, or no department support, but you can do it at home, and we can send you a complete set of exercises, videos, and give you online physiotherapy to ensure that the knee ligament surgery you have undergone gets an optimal result.
Right. I hope Adil, that answered your question. And as Sir mentioned, throughout the lockdown, we have successfully been treating patient to complete recovery through online sessions. We have been able to impart the same kind of physiotherapy as a physical session. So do get in touch, and we should be able to help you with this. So the next question we have is from Sangeeta Bhujbal, Sangeeta Duma, and it's a suggestion that we should be doing these sessions in Marathi, so more and more people can understand that. We surely take this in consideration, आणि पुढच्या वेळेपासून आम्ही प्रयत्न करू की आम्ही मराठीमध्ये पण हे सेशन करू शकू. सो क्वेश्चन इज की मला स्वतःला लिगामेंटचा प्रॉब्लेम आहे. मला स्वतःला भीती वाटते ऑपरेशन सक्सेसफुल होईल की नाही. माझ्या पायात मुंग्या येतात. काय करावं हे समजत नाही.
हो, हो, हो. खूप चांगला प्रश्न आहे संगीताताई. जर तुम्हाला लिगामेंटची इंजुरी असेल, जर तुमच्या डॉक्टरने तुम्हाला सांगितलं असेल, की ही लिगामेंट तुटली आहे, एम-आर-आयवर दिसतंय तुटली आहे, तर तुम्ही काळजी करू नका. ऑलरेडी तुमच्या पायाला मुंग्या यायला लागल्यात. ह्याचा अर्थ असा आहे, की तुम्हाला गुडघ्याला अस्थिरता आहे. आणि जर ती अस्थिरता असेल, गुडघा दुखत असेल, तर शस्त्रक्रिया करून घ्या. आता खूप नवीन आधुनिक पद्धती उपलब्ध आहेत ही सर्जरी करण्यासाठी. ही दुर्बिणीद्वारा, लेझरद्वारा ही सर्जरी होते, आणि त्याचे जे रिझल्ट्स आहेत ते अतिशय उत्तम आहेत, आणि तुम्ही पूर्णपणे नॉर्मल होऊ शकाल. त्यामुळे मनात भीती बाळगू नका संगीताताई. तुमचे ऑर्थोपेडिक सर्जन आहेत, त्यांना भेटा आणि ही की होल सर्जरी जी आहे लेटेस्ट ती करून घ्या.
Thank you so much, sir, for answering that. Next question is, so good morning. I've gone through ACL surgery twice. Precautionary measures to avoid further damage. This question is from Sridhar.
Yes, Mr. Sridhar, if you've undergone ligament ACL surgery twice, that means the first was there and the second was the revision ACL. So what happens is that when you have two ACL surgeries, you have to be extremely careful, because your chances of having a third injury are very high. So the most important thing is to have a good rehabilitation program, and don't get back to sports. You can wait as long as 8 months or a year to get back to strenuous activities, contact sports. And the main thing what you have to do in this period of 8 months to a year is good rehabilitation, strengthening your muscles. And there are various tests which can actually predict your return to sports or return to active lifestyle. And Saurabh and the other physios, sports physios at Healyos, can guide you through that. But my answer to your question is the precautionary measures you have to take to avoid further damage is good physiotherapy, rehabilitation, and avoid contact and strenuous sports for a period of at least 1 year from your second surgery.
Yeah. I hope, Mr. Sridhar, that answers your question. We have another question. This is from Jyoti. Can we do other day-to-day exercises like yoga, warm-ups, jogging, etc. post knee operations? Apart from given knee exercises, what other precautions to take in it?
Yeah, so the question you're asking is, after knee surgery, can you do yoga, warm up, jogging? It depends on the duration of your surgery. If you are in the immediate post-operative period, like within 4 to 6 weeks, then doing jogging is not a good idea. But if it is 3 to 4 months, light jogging can be started. If it is 6 to 7 months, then you can get back to your full jogging. Regarding yoga, again, what kind of yoga you're doing is important, because certain positions in Vajrasan, Padmasan, and can actually, give full deep flexion to your knee and cause damage. So again, a period of 5 to 6 months would be ideal to wait before you can do all kind of yoga. That being said, the upper limb yogas or certain positions of the yoga can be undertaken. Warming up, of course, is you can do it. There's no problem. Actually, that is important because that means you're just getting your muscles acclimatized to what you're going to come in for. So that kind of exercise are good. There is a protocol which we can actually share with you, Jyotitai, and we can give you that protocol. We have a complete 6 month protocol, and the physios at Helios will be happy to share that 6 month protocol of physiotherapy with you. So just connect to the Helios, and we will give you that 6 month protocol, and you can follow that.
Very true. And we are always happy to help you, Jyoti, for sure. We have another question. It's from Akash. How much time in months it will take after a ACL surgery to play cricket?
Yeah, excellent
It's a
question,
very
Akash.
specific question. Yeah.
So it again varies, after doing an ACL surgery. It depends on the type of graft which you have been used upon. There are two types of basic grafts which they use. One is the hamstring and one is the bone tendon bone. So depending on what has been used is also important. Secondly, the level of rehab, what you do is again important. But generally, I would say to get back to cricket, if you're a bowler, at least I would say that it would take 6 months, or if you're a batsman, also a little less. But then, anything can happen. So I would say the ideal period after ACL surgery is 6 months to get back to cricket.
Right. I hope Akash that answers your question. The next question is from Mr. Ramesh Chavan. He's a patient of yours. Dear Parag, sir, you have done my ACL tear revision and now I have completed 6 months to it. Please tell me how many months I have to exercise daily. He has some network issues and he really wants you to answer his question.
Yeah, yeah. So if 6 months are over, Ramesh, not to worry. I think you can now slowly get back to some level of sports, some level of warming up, some level of jogging, cycling. I would say swimming is very good, and start doing all of that. I would be happy to see you at some point of time. I know it's the lockdown period, but the best way to advise you further is to do a clinical evaluation. I have started seeing patients in clinic, so you're most
So,
happy to make an appointment and come and see me, Ramesh. But generally, what I would like to say is that if
so
six
just,
months are
just
over,
sorry to interrupt. He's requested to answer this in Marathi, so if you can please.
येस. सो रमेश, आता 6 महिने जर ऑपरेशनला झाले असतील तर मला असं वाटतं की थोडं-थोडं तुम्ही जॉगिंग, लाईट जॉगिंग, सायकलिंग हे चालू करा. वॉर्म-अप एक्सरसाइजेस चालू करा आणि एकदा संचेती हॉस्पिटलला जर येऊ शकलात तर मी तपासू शकतो. आता ओपीडी चालू झालेली आहे आणि तुम्ही अपॉइंटमेंट घेऊन या. आणि गुडघा तपासून मग मी तुम्हाला एक्झॅक्टली सांगेन. पण तोपर्यंत लाईट जॉगिंग, सायकलिंग, पोहणं ह्या गोष्टी तुम्ही करू शकता. ऑनलाईन फिजिओथेरपी हिलियॉसद्वारे घेऊ शकता. पण एकदा नक्की तपासायला पाहिजे कारण ही रिव्हिजन सर्जरी आहे, म्हणजे दुसऱ्यांदा सर्जरी झालेली आहे. त्यामुळे अतिशय आपल्याला काळजी बाळगली पाहिजे बिफोर स्टार्टिंग ॲक्टिव्ह स्पोर्ट्स.
आय होप रमेश त्या प्रश्नाने तुमचं उत्तर मिळालेलं आहे आणि ॲज आय सेड अर्लियर तुम्हाला काही फिजिओथेरपीच्या रिलेटेड गरज असेल तर तुम्ही एलियॉसला कॉन्टॅक्ट करू शकता आणि आमचे फिजिओज विल ऑलवेज बी हॅपी टू हेल्प यू. We have two very interesting questions from Mr. Rahul. One is many people are frightened for doing ligament operations. Any suggestions for them? Which is very true.
Yes, so I think once you have a ligament injury, as I told you, people are very apprehensive. Anybody, doesn't want a surgery, and they will always ask you that, should I undergo this surgery? Is there any alternative way? That's the first question. So, if the surgery is required, don't be afraid of it because now we have the latest techniques. We have the latest equipment also to ensure that you get a good result. There are very good physiotherapy techniques, rehabilitation methods available to ensure return to sports, and the surgery is almost painless. One of the reasons, Rahul, why patients are apprehensive is because of the pain post-operatively. But let me tell you, once the surgery is done, the patient is discharged within 24 hours. He goes back home, he's able to do his routine activities the very next day. And the period required to get back to your normal routine is literally 3 weeks. There is no pain. and the result
True.
is almost assured with a good outcome. So don't worry, Rahul. If you have a ligament injury, please come ahead, go ahead and get it done.
He has another question. At remote villages, it's very difficult to get a good rehab. So, what should we do?
Yeah, that is a problem. बऱ्याच वेळा जे गावातले काही पेशंट आहेत सध्या त्यांना येता येत नाही लॉकडाऊनमुळे. रिहॅबिलिटेशन जास्त चांगलं मिळू शकत नाही कारण तिथं फिजिओथेरपिस्ट पण अवेलेबल नाहीये. सो फॉर दिस सर्वात चांगलं आहे की ऑनलाईन फिजिओथेरपी आता आहे, व्हर्चुअल फिजिओथेरपी आहे. वी स्टार्टेड व्हर्चुअल क्लिनिक्स आणि त्याच्याद्वारे फिजिओथेरपी दिली जाऊ शकते.
All right. Okay. So the next question is from Sarita. Post 4 months of ACL reconstruction, if patient still has knee swelling, what could be the reason?
So there are various reasons, Saritaji, why swelling can happen after ACL surgery. And if it is especially that you didn't have swelling for 3 months and now the swelling has started, then it could be that there may be effusion inside the knee joint. When I say effusion, म्हणजे गुडघ्याच्या आत पाणी झालेलं असतं. So there is some reason why fluid has accumulated in your knee joint. And that can be because of a re-injury which may have happened. It may have happened unknowingly if you have overused it, and there is something called as synovitis that can happen. So that is the first reason. The second reason is because of sympathetic stimulation. You know, if the muscles are weak, if the muscles are not strong, then there is the sympathetic overactivity, and that itself can cause release of some fluid and the synovial fluid in the knee joint and can get swelling. The third reason is if for some reason the metal which we put inside or the plastic screw which is absorbable screw which is inside, there is a reaction, what we call as the foreign body reaction, which can happen to the absorbable screw or the endo button, which is a titanium plate, and that itself can give a reaction, delayed reaction, and cause swelling. So it is very important to examine the patient. If you have it, then you have to examine it and determine which one of these cause is applicable to you, and also get an MRI done, which will make us more knowledgeable of the reason of the swelling of the knee joint after ACL surgery after 4 months.
Yeah. Thank you for answering that in such detail. So, so we have received also some questions in personal messages. So I'm just going to read it out to you. So,
Sure, sure.
does getting an ACL tear in one knee make a patient prone to getting an ACL tear in the opposite knee? If yes, what precautions can such patients take?
So what happens is once the ACL surgery is done, then you have a 20% chance of getting an ACL injury on the opposite side, and it has been known. So
Right,
once an ACL surgery is done, once you're doing the rehab for your operated knee, at the same time do rehab for the non-operated knee also, because many times people
right,
feel, oh, my right knee is operated, I'll just work out and do more rehab for the right, and they ignore the left. But they should not do that. They should also rehab the opposite knee which is not operated. At the same time, the first 6 to 8 months is the period when this can happen, because by default you try to put more weight on the non-operated leg, which is the good leg. The operated leg is the so-called weak leg, and therefore you try to put more weight unknowingly, inadvertently, on the good leg, the good knee, and that makes it more prone for injury. So be
right,
careful that you are not in that 20%.
right. Uh, I guess this is the last question that we are going to take.
Yes.
What are the chances of subsequent knee arthritis with conservative and operative treatment of ligament injuries?
Yeah, that's a very good question. And after conservative treatment, if there's a complete ligament injury, a complete ACL tear, the chances of developing arthritis are as high as 14 to 24%. Also we have seen in patients who are, active athletes, who are elite players, they sometimes kind of avoid surgery, because they don't want to miss the season. They just
Right,
bear the pain, they take injection shot, and then they kind of carry on with it just because of their willpower and by medicine. And then these are the patients I've seen who just once they retire or once the season is over, they get too much pain, or after a few years they develop arthritis. So not treating a ligament injury of the knee makes you more prone for arthritis. That being said, there's a small subset of patients in whom also if you operate, then there are chances that you may get arthritis, but that percentage is very low. If you don't get operated, your chances of getting arthritis of your knee are much, much higher.
Right. Okay, on that note, sir, thank you so much for taking the time out. It was a wonderful session. You've really simplified all the concepts of ligament injuries, their causes, and their management options that we have. You've really given a very simple explanation to what factors are taken into consideration for deciding surgical or non surgical management. And I guess this session has been very helpful to all our viewers who've had questions about ligament injuries in their mind and that phobia of should I get a ligament surgery or not. So I guess this was a very wonderful and informative session. So all the people who had that dilemma in their mind, thank you so much once again for taking the time out.
Thank you, Saurabh. I wish to thank you for taking out time on a Sunday for you to ask me questions and interview me. I really thank you profusely. I also want to thank Healyos for this excellent initiative, which is very, very helpful. I want to thank Rupal ma'am also for her starting this initiative, and all your physios and all the staff at Helios. Thank you. Have a great day ahead. And if there's anything more, please feel free to reach out to me through email or directly call me. And I would be happy to answer any questions related to knee injuries. Thank you. Thank you,
Perfect.
Helios.
Thank you so much. And to all our viewers, do follow Sancheti Hospital and do follow Helios India on Facebook and Instagram. We keep updating a lot of informative stuff related to musculoskeletal injuries and other issues. And we will come back to you on next Sunday with another surgeon and another perspective. Thank you so much.
Thank you.